Welcome to this brief video on structured reflection from the Department of Family Medicine at RCSI Perdana. My name is Professor Anthony Cummins. What is structured reflection? Why is it important? How will we teach and assess it? And how do we define it? Aronson in the University of California, San Francisco, defines it as the analysis of personal experience to enhance learning and to improve future professional behavior and outcomes. Based on Gibbs cycle, which first of all looks at the event or the experience in which the protagonist, the student, gives a description of what actually happened, and then goes on to describe the feelings and thoughts that they experienced at that time, how they evaluated this event, this experience, what was good and what was bad about the experience, and then to go on to analyze it further to see what else they can make of the situation. You will then draw some conclusions about what else you could have done perhaps. But most importantly, an essential part of reflection is the action plan. In other words, how will you deal with this differently in the future? What did you learn from this experience that you can put into action the next time you see a similar event or experience? And does it matter that we reflect on our experiences? Does it have any impact on outcomes? Well, the published evidence suggests that it does. And in all these areas, student exam performance and specifically student clinical performance in OSCEs with standardized patients, it makes a significant impact. Also in medical residents in the US, there are reduced diagnostic errors and a greater number of the residents achieving their rotation goals. So overall, it is felt that doctors in training who make reflection part of their everyday practice, they make better use of feedback and overall do better, and so do their patients. Shun in 1983 defined a reflective practitioner as someone who's able to identify essential professional problems, to challenge self-evident truths, to seek feedback, and to use it for their personal professional development. To help you in your reflection and in writing your reflective account, we have a variety of things available, aids available to you. There's an online PowerPoint presentation which you should read prior to the class-based facilitated session. There are also examples on Moodle of structured reflection accounts. There are also the potential for assistance and help from your tutors, both in faculty and outside in the community, the GPs, the clinic Kesehatan doctors, the hospice militia staff, to help you with formative feedback on your assignment. Your reflective assignment in this rotation will be an account of an experience during the family medicine rotation. They should identify within this a learning need, and this should be related to one of the learning outcomes for family medicine rotation. This is from a textbook of general practice and has a section looking at practical exercises to do to help reflection. So, for example, think about something that you've experienced during your family medicine rotation. Begin by writing down what actually happened, and then consider what you felt confident about during this episode and what you felt uncertain about. How did it make you feel? What do you think other people around you felt? The patient, perhaps the clinic doctor who was present. What did you learn from this experience? And what might you have done differently? You should then draw up some action points to work on so that you can feel more prepared for the next time you encounter a similar experience. Other aids to reflection would be using open question sheets, generating lists, or writing full significant event analysis. This should embrace honesty. This is a cardinal ingredient here, that you should be totally honest about your emotions and your feelings at the time. And only in an atmosphere of honesty and safety can you disclose your feelings to your GP tutor or your clinic Kesehatan doctor. Another concept is the concept of the Johari window. so that feedback from others, or self-assessment and reflection on our work, can illuminate areas that we wish to develop or change. However, this is where the honesty comes in. If we wish to hide some of our weaknesses or black holes, then we may not be able to engage fully with reflection. The Johari window is named after its two developers, Joseph Luft and Harry Ingham, who in 1969 showed clearly the various states of self-knowledge. You can see this in figure 15.6 here of the Johari window. The idea of self-assessment and accepting feedback and reflecting is to expand the open window and minimize the others. If you and your tutors become more aware of your problem areas, you are in a better position to change them. But the relationship between learner and tutor, although playing a central role, has to be based on a trusting and supportive relationship, which provides a safe environment in which to discuss sensitive issues. So during your family medicine rotation, have you identified a learning outcome? Say, for example, something simple like taking an appropriate history from patients. But lots of distractions can occur. For example, this quote about the first day I started my clinical attachment, I was taking a history and the patient became very annoyed with me because I asked the same question twice. You could also choose a situation for reflection, perhaps a time where you didn't have the necessary knowledge or skills. You just started family medicine and you were unaware of many aspects. Or maybe a situation that went well, but you weren't sure why it went well, or something that was complex, surprising, uncomfortable, or uncertain, in which you felt personally or professionally challenged. How can you use the Gibbs cycle to structure your reflection? Well, first of all, describe the incident or experience during the rotation where you identified this learning need. Share your thoughts and feelings at that time. Describe how you evaluated the incident, describe how you analyzed it, and outline the conclusions you made from this analysis. And look at how this process will impact your future practice, behavior, or attitude when you encounter similar experiences. So when you're writing up your assignment, in terms of what happened, give a concise factual account so that the reader is put in the picture and knows exactly what's happened. Then describe what you were thinking and feeling at the time, and try to explain why you felt or thought like this and how it impacted on your actions. It's essential, though sometimes difficult and challenging, to be honest about your reactions. To evaluate it, stand back from the experience to consider what was good and what was bad about it. Identify your learning need and relate this to one of the learning outcomes in the family medicine rotation. Can you make sense of your own thoughts and feelings and actions around this incident? Are there alternative perspectives or theories to help with this process, to help you make more sense of the incident? Could you get some help through feedback from your tutor? What conclusions did you make? Briefly outline the main factors affecting the situation, the key things you learned through the reflective process, and areas that you feel need to improve. Then devise a plan for future action, so that if this incident or experience recurs, how would you deal with it the next time? When you are composing your reflective assignment, it might be useful to sit down with your tutor in the general practice at Clinic Kesihatan or HKL OPD setting, or even with faculty, to review this reflection with you. This may help, as their input may explore areas that you have not yet fully explored. They may also help to identify errors in reflective writing. When we started teaching reflection, some students were simply writing a diary of events that occurred throughout the 7 weeks. This is not what we expect you to do. We expect you to take a particular incident and reflect on that. So, for example, if you simply describe what happened, but didn't have a learning need and didn't therefore fully reflect, then there's no action plan. And intellectualizing or reflection without an action is meaningless navel gazing, and it's a waste of your time. Successful reflection, on the other hand, links past, present, and future experiences. It integrates cognitive and emotional experiences. It considers experience from multiple perspectives. How did the patient feel about this? What would the tutor think? It involves reframing, stating lessons to be learned, and it plans for future learning and behavior. Here are some references for you. And the one which has the Buhari window is the textbook of General Practice by Anne Stevenson. The first two are well worth looking at. Aronson's Introduction to Critical Reflection, and also the PDF from Queen Margaret University, Edinburgh. There's a section also in the Oxford Handbook of General Practice on reflection as part of adult learning. And finally, there's a reference to an Australian general practice describing how they use patient encounter data for reflective learning in family medicine training. Thank you.